just wanted to welcome you to the Business of Health Career Networks program. Um, and tonight we have a special panel. And this panel is called Transforming Healthcare from the Inside, Health System Management Careers, which is part of the UNC Center for the Business of Health Career Networks program. Career Networks is a constellation of resources meant to educate and create community around the continuously evolving healthcare ecosystem. You can explore the CBOH Career Network platform via the URL that I'll paste in the chat box in just a minute. For tonight's panel, we ask that you turn your video on and mute your microphone while not asking questions. If you are in clinic or somewhere where you just can't share your camera, that's fine. We totally understand. Tonight's panel will begin with our guests introducing themselves. Then I'll be asking moderated questions. I'll stop every 2 questions for kind of like a formal audience question period. But if you have questions in between that, please raise your digital hand. Or if you can't use audio, feel free to paste your question in the chat box, and we'll be looking for those chats. I'm Suzanne Killian, Associate Director for Student Engagement with the Center for the Business of Health, and I have Erin Leach, our Program Manager, behind the scenes tonight. Tonight we have with us 4 outstanding panelists, Micaela Acomb with the University of Chicago Medicine. We have Greg Duffy, who's with UNC Health Physicians, Matt Gitzinger with UNC Health, and Trini Thach with Duke University Health System, who will share their career journeys and introduce you to the industries from their diverse perspective. So I am going to just begin and allow them to introduce themselves, tell us a little bit about their career journey, their educational journey, their current role, and we welcome you all. So I'm going to go ahead and let Micaela start us out.
Sounds great. Thank you, Suzanne, and thanks all for joining today. Really great to see you all. My name is Micaela Acomb. As Suzanne mentioned, I work in strategic planning at University of Chicago Medicine Health System, which is a large academic health system. No surprise here, based in Chicagoland, with offices all around Greater Chicago and Northwest Indiana. Been here about 4 years. Prior to that, I was at IBM Watson Health in their healthcare division, working in product marketing, so made a bit of a career transition there. And then prior to that, I was at UNC getting my master's degree. I did the full-time MBA program as well as the MSPH in health policy and management. Yeah, I think I'll turn it over back to Suzanne.
Great. And then we can popcorn around. Like, why don't we go Greg, Trini, and then Matt.
All right, great. Hi, everybody. My name's Greg Duffy. I'm currently a System Executive Director for Operations and Strategy at UNC Health Physicians. I've been at UNC Health now for 9 years, mostly working on strategic projects. So I started out in strategic planning, then went into customer experience, and then now currently work in the physician group. And so we look at things, how to organize and create efficiencies across different areas, as well as look at growth programs. So I've looked at quite a few different opportunities to look at expanding services in areas like behavioral health and virtual care, as well as in rehab and inpatient rehab and cancer. And currently just trying to work with our physician groups and create efficiencies in operations. I've had quite an odd journey to get here. I spent actually 20 years in the military, retired Air Force, taught ROTC here at Chapel Hill, and I ended up retiring in the area. Got my MBA through UNC as well. Did the online program as I was getting out of the military, knowing that I wanted to kind of transition to the area. And then went into actually management consulting for a few years with a local company. And then realizing, probably for my military service, want to do some service, and also thinking about long-term working in healthcare as well as in humanitarian operations, want to get involved in healthcare. So that's why I made that transition a few years ago to this. All right. Thanks. I'll turn it over to Trini.
All right. Thank you. Hi, everyone. It's great to be here. Thank you for logging on. I was telling my co-panelists earlier, it's great to be among Tar Heels. I know I'm here representing Duke University Health System, but it's nice to be around UNC grads and UNC students. So my journey started with UNC as an undergraduate. following my undergraduate career, I started in health policy research actually, and spent a couple of years for working with a company called RTI International. I loved the research world, loved the policy world, but really realized during that time that I really wanted to be in the doer seat and on the execution side versus on the observation and research side. So that's when I made the decision to return to UNC for a second round and get my master's in healthcare administration from the Gilling School of Public Health. Since then, I have been with Duke Health System, starting with a role as an administrative fellow. I know a lot of MHA students take that path, and for me, it was a really rewarding path and gave me a lot of exposure to different segments and areas under Duke Health System. And following that, have served in various seats supporting operations, strategic planning, and special projects until about a year ago, I transitioned into our finance department, serving as chief of staff for our CFO and treasurer for the health system. And that's been a really fun role. And similarly, it's a good variety of special projects supporting enterprise initiatives, growth, and still learning and enjoying the role, and just happy to be here to share my journey and my learnings so far. And I'll turn it over to Matt.
Thanks, Trini. Hey, good evening, everybody. It's good to be with Tar Heels, even if we're sad after the last few weeks. But I'm Matt Gitzinger. I'm the executive director for population health management at UNC, and so I get to work alongside Greg. And I've been doing this for about 7 years. Prior to that, I was at ECU Health, where I was in hospital operations and corporate services. I was an undergraduate nutrition major at Gillings. I don't want to say how long ago, but then I went to Virginia Commonwealth for my Master's of Health Administration. And I think it's an interesting little story, and I'll share with you real quick that a lot of that reason was I saw myself going into one-on-one care for patients, and I wanted to have a lot bigger impact. And thankfully, I ran into a Gillings MHA student who said, there's another path out there. So I pursued that, and I'm really pleased with it. And I can tell you a little bit more about why. But it's been really gratifying to be able to touch a lot more patients through this career. Suzanne?
Terrific. Great introductions. And as the audience hopefully can see, there's such a diversity in opportunities in healthcare beyond just like the clinic, even though some people work very close to the clinic. So this is just a great group to have tonight so that you can kind of see and find out a little bit more about many of the roles, and also how people move throughout their career to gain those skills, or even if all of a sudden you say to yourself, wow, I need just a change, or I want to do a little something different, that's always a possibility. So again, thanks for those great introductions. But I am going to go ahead and start with my second question, and that is, how is working in a large health system unique from working elsewhere, which many of you all had careers prior? And again, we can popcorn around, so feel free to jump in.
I can start with that one. Sure. I spent 20 years in the Air Force, so I know, public service or government service well, and then spent a few years consulting with a couple large utility companies. So saw some of their types of operations. And I think what is different about a health system is probably two things, right? One, and maybe this is UNC, like we are very mission oriented. So the people here are very tied to why they want to do the work, right? Which is kind of compelling to why I joined healthcare in the first place, right? It's like, I did public service, and I think joining a healthcare system is kind of public service to folks. And so people feel very compelled to that. And it's really good to get that feeling, even though, so like when you have bad days, people all realize they're still going to work really hard because they're trying to help people get better, right? And while there's probably a lot of inefficiencies and things we can work on, we're all sort of trying to go to that direction. Now, on the other side of that, though, is UNC is a system with 14 hospitals that are part of the UNC health systems, as well as physician groups. But we're also what they call managed and owned. And so when you have managed entities, they have their own contracts, basically. It's like having, I don't know, I would say if you think of like the Chick-fil-A model, they're all part of, like, they're owned by Chick-fil-A, but then they franchise out, versus like a different model where like each person can run their own little place. And so we have that's where the trick is of trying to maintain that balance and trying to create uniformity and consistency across the system so that our patients can get the same kind of care and access to the same opportunities across our system.
I would just agree with that, and then add to that there is something really special about being able to work with physicians, which maybe you get some of in other healthcare sectors, but probably the most working in a provider setting. I think that oftentimes the physicians are like so incredibly like some of the most passionate, intelligent, driven, mission-driven people, and so being able to like put yourself in their shoes to the extent that you can if you're not a clinician, which I am not, and understand their point of view and like work together as you're, developing, in my case, the strategic plan for whatever project you're working on. And then also, since we all work for an AMC, I think there's some amount of some distinction between working for an AMC and what I would imagine working for like a community-based health system, which is you also have the education and the research pillars, which depending on which AMC you work for, might be more or less ingrained in the work that you do, depending on your role.
Yeah, I'll chime in to echo Micaela and Greg there. I think working for a large healthcare organization can be really rewarding because the mission itself is meaningful and you're working alongside clinicians to deliver better care to patients and to improve access and enhance outcomes. So all of that makes it really, really easy to motivate and orient your team members to a common mission and goal. I think the other unique aspect of working in an AMC and systems large like the ones we're all coming from is that everything is so interconnected and interdependent. You can't really make decisions in a vacuum. Something that one team is working on in one area will inevitably affect a work stream in other areas. And that's kind of the fun of the problem solving piece. So I really enjoy having that opportunity to reach across different functions and different areas and work towards those solutions together. The complexity is part of, it's the hard part, but it's part of the fun as well.
I'm glad you said complexity. That was the word that like stood out to me. And I'm amazed that Greg didn't say bureaucracy, because sometimes it can feel that way, right? In a really big organization like ours. Um, I think the one thing I've learned is that um, when most of your revenue comes from the state or federal government, you're going to be challenged and you're going to have to think creatively about how you make it work. So margins are slim in healthcare and a lot of parts of our organization, not equally necessarily. And then I think another really interesting complexity to it is that we have really, if you think about it, several different customers. Oftentimes, we've got patients, we've got our providers that we often think of as partners, but in my work, we really try to make sure that they're happy customers of our service. And then, of course, our payers. And so it's a unique place, but I would say the complexity also means opportunity. And so if you are creative and willing to try to figure out how best to serve the patient despite that, to figure out systems that make it easier, you will succeed and you'll have I think, a really meaningful impact.
Terrific. Again, wonderful answers to my first question, but I did write down complexity equals opportunity because I'm going to use that one. That's a really wonderful way to show that although complex, meaning the jobs are very meaningful and there's a lot of creativity as well. So I'm going to ask my next question again, too, as you all talked a little bit about working in like a large healthcare system, what surprised you about working in a provider system or a healthcare system, or what misconceptions are there that people might have that surprised you?
I can start. I feel like when I started grad school, I didn't really have any intention of working for a provider. I kind of saw myself more along either going down the consulting route or the government health or something in that realm. And so I had this misconception early on in my grad school journey that if I worked for a health system, it it would be like operational. I would be running around a hospital, like running clinics, putting out fires, which is very much a roles that do exist. But I wasn't really thinking, if to be very candid, I wasn't really thinking broadly enough to understand, oh no, there's like whole shared services and all different functions, any function that you can imagine, like probably also exists in a health system. So I admittedly was a little naive kind of going into it, which is kind of how throughout my 3 years in grad school, I was exposed to many, many different sectors. And was able to kind of like learn from other people in these roles. Like, no, there's lots of opportunities and there's opportunities that can actually fit your interests. My job today is not putting out strategic planning fires by no means. It's like a good mix of independent analytics and storyboarding and problem solving in parallel with leading and facilitating work groups with other leaders across the institution. So I would just kind of keep an open mind if you're exploring roles in the health system and know that there's lots of opportunities in different segments, and the four of us just represent four of those opportunities.
All right, I'll go. Yeah, I think those are great points to make, and I'll build on that complexity equals opportunity a little bit. And I think actually partly why I got into healthcare. I mean, having worked in the government and Pentagon, which is very complex, I knew I wanted to do something that creates opportunity, and so I knew healthcare is a very complex area, and so there'd be lots of opportunity to create solutions and solve problems, right? And so that's actually kind of why I got into it and to help folks. But what surprised me, I guess a couple of things surprised me. Having done like the MBA, you learn all about your finance and you learn about, cost accounting, all these things like making margin. And then you come to the hospital and it's like finance worries about the money and everybody else just worries about the patient. And so that's like the most surprising, and one of the surprising things, right? Is like who thinks about the money? And to some degree, um, most people, because I mean, they're so involved in patient care and taking care of the patient, they don't know really how we make money, and that can be somewhat of a problem when you're trying to think about like what shoe opportunities we should do or why we should do something versus something different. And maybe Matt can talk a little about this because I know his role involves some of those kind of thinkings. But why should we do one project versus another? And the things you learn, like which specialties make the most money, and that's partly probably because the way CMS, Medicare and Medicaid and payers have designed the payment system of how they pay for things. It's not necessarily that's the most important care, but that's just the way it's designed. And so you have to work within some of those constraints to figure out what you want to do, which, is a lot of complexity, a lot of regulation, but like I said, a lot of opportunity. And so somebody who wants to solve problems and help folks, you're really trying to get creative in how you can do those things. And I'll give one final example. Sorry. I did one of the things I got involved with behavioral health here and solving that problem. And COVID became a big area, and so that's a big problem. Like folks are staying in the ED a long time. How do you get care? And so and how do you get paid for it? And we found a model. I think that Matt's groups now can use the collaborative care model. We figured out a way to get keep behavioral health patients within our primary care through use of social workers as well as psychiatrists. And University of Washington developed a business case of how to get paid for. And so we just stole their business case and implemented it, and it's better for our patients.
I would say we improved upon it, Greg. We didn't steal it. No. Yeah, I think it's a perfect example, though, of how presented with a problem, like we respond. And so uh, that's one thing I loved about being here when we went through COVID. I had a team that all they did was outreach to patients to say, come in for a visit. And then all of a sudden, COVID was like, don't come in for a visit. And so we set up a virtual care department to make sure that, they could have their COVID questions answered quickly. They could talk to a provider, and that has spun off into a wildly successful virtual care program that serves across the state now. Um, I would say something that comes to mind as I think about the what misconception I had. Healthcare is designed that you have to work towards credibility. Like you can't assume um, authority necessarily. And what I mean by that is medical staff is separate from, and not often, whether they're employed or not, they're separate and they're governed by different rules. And it's set up that way so that the patient's interest is always protected. Now, what that presents for us as leaders is that we have to work to build credibility with our physicians and our providers, because if something that we're selling isn't what they're buying, it isn't going to pass. And so I think all of us have probably spent a lot of time figuring out how to find partners, dyads, as we might call them, administrators and physicians, to develop business cases and say, wouldn't it be great if we rolled out a collaborative care model? And then figuring out how to use your partners like them to really advance the system's aims. We wouldn't be successful rolling out a collaborative care model for behavioral health if we didn't have a fantastic psychiatrist doing it beside us.
And I can wrap us up on this one. Something Greg said made me think of how when I was contemplating this role in finance, I was concerned it would put me at odds with our clinicians or operations. There might be that perception with the finance team sometimes that it's all about margin and improving our financial outcomes. And what I found in this role is that it's okay to have different agendas. Not everyone needs to have the same exact objectives. And it's that diversity in perspective, agenda, goals that helps us advance the mission of the organization. We hear this in healthcare sometimes, no margin, no mission. So it's really important to have the voices of our finance leaders, of HR, looking out for our workforce, of our operational leaders and clinicians, and that sort of multidisciplinary approach has been a uh, really important part of my interest in staying in the field of healthcare, and something that I find, I have more comfort with that lack of consensus. Sometimes we're working towards that consensus, but it's okay for there to be these smaller disagreements as we're working on bigger solutions. So I think that's one perhaps misconception I had going in, that, we all have to be super aligned, but it's the differing agendas and perspectives that helps us come forward with a more thoughtful or multifaceted solution.
Perfect. Again, the responses were very well rounded, but I love the mission driven. But yet, as you all said, you kind of have to look toward partners to help you with that mission. It's and not just like, oh, the bean counter's here and then everybody else over here. So that's fantastic. I'm going to open it up for questions from our audience right now. So if you want to raise your digital hand, again, down at the bottom, if you see the kind of like react, it's got a little heart. You can go into that little button and then you can see the digital hand, or you can just unmute and just ask your question.
Hi, thanks again for everyone for sharing your perspectives. It was really interesting to hear. My question is more for how can physicians come alongside you guys to help achieve, I guess you said like similar objectives, not necessarily the same one, but how can we come alongside you to help achieve your mission? Thank you.
Ooh, that's a tough one. I think it's all about where you're going and what you're trying to accomplish. And then I think so setting out that plan, that goal with them. I work largely in our value care part of UNC. So UNC Health Alliance is our accountable care organization. We're a clinically integrated network. And so a lot of that relies on physician partnership. Um, I would say what I've learned over this time is our organization and our insurers often set our goals together in accountable care. And then I think what's been really helpful is to go along and find partners that can help you to lay that out a lot better. So, for example, some of our contracts say we need a certain percentage of annual wellness visits completed each year. And to some providers, that can be a very off-putting thing. So you want me to do this the visit that I don't see value in. And so what I try to do is find a good physician partner who has seen the value themselves and then deliver the data that also suggests, an annual wellness visit closes at least two care gaps for a patient. So without it, we miss opportunities. And then ideally what I do is I give them those talking points and I have them help me deliver those to our skeptical providers.
Great.
Yeah,
Thank you.
I'd say,
go
I mean,
ahead.
right. I mean, Matt's got a difficult job, right? Like for those folks that, the Health Alliance, population health, they have all the contracts we have and they've got to maximize, and all our contracts have what they call downside. So if we don't achieve certain goals, we lose money. And a lot of those are clinical outcomes. And so you've got to get physician buy-in on these clinical outcomes, which they may not have been paying attention to, right? So that's pretty tough. They do a really good job over there. I would say, to your question a little bit is, and so he probably, looks for you guys to help with him. Our job, I mean, it's kind of like Micaela's. I try to like, how can I help physicians achieve some great idea that they have, right? Because, and that's what usually works for me a little best, right? Like with the behavioral health area and that whole collaborative care model we were able to launch, we put together a behavioral health steering committee with our department chair and said, like, what are the top objectives you want to, and we started looking across the gamut of things. And that's one of the things that came up. And then we had, like Matt said, we had, some psychiatry leaders were really motivated and they took that on, right? And they wanted to do that. And so we were able to find a way, make a business model that helped them achieve that goal. Um, Another thing, actually, more recently, I just finished a coaching program. So now I do coaching here at UNC Health, and I coach a couple physicians. And so it's been really good for me because these are folks I might not otherwise touch because they're not senior folks in their specialty, but they've all got great ideas. And what I'm learning is they just don't have an avenue to get their ideas out. And so this has really been fun for me because I'm helping them based on my strategic planning role and who I interact with, able to guide them of how to get their ideas out there, right? And so I think that's something we need to take on as a system is how to help our junior physicians become more impactful, right? Because I'm sure they got you guys right have all these great ideas of how to improve care and how to take care of the patients and really motivated, right? You're used to not sleeping at all, staying up all day and things like that.
Yeah, I just quickly just to endorse what you said, Greg, about working with the physicians to help them get their ideas out and their business plans built in a way that is consistent with, how senior executive leadership like reviews these plans is definitely part of the job in strategic planning and how we I think a really important piece of that being successful is having some element of trust between yourself as the administrator and whoever the physician leader is you're working with, and be able to bounce ideas off of one another so that together you're coming up with something that makes clinical sense from their perspective, but also makes like business sense from the administrative side and has the legs to kind of go up the chain.
Terrific. Thank you. And thank you, Alicia, for the question. All righty. We have a few more questions actually in the chat. But before we move on, my next question was going to be very similar to the question that you all were answering. So I just wanted to know, you mentioned, again, physicians as partners, insurance companies as partners. Is there anyone else that you see as, or interprofessional functions that you work with other than insurance folks and or physicians?
I was going to comment on when I joined our finance team, I was really just thinking about finance as, our monthly reporting, our budgeting process, our planning for the upcoming year. And one of the realizations I've had in this role is it represents a really diverse scope. And so this is somewhat professional functions, but even within finance as a whole, the scope for our division includes real estate. It includes supply chain operations. We partner very closely with legal, revenue cycle, and I think one of the teams that I partner a ton with on is our HR team, because I think in any leadership role or capacity, you are going to be working with HR on development plan, workforce planning, and how do we really upskill our staff and think about the next steps from that perspective. So I would say both within the finance sector, it's more diverse than I imagined. And then beyond that too, we have really great partners across HR, legal, and all the other fields Suzanne was mentioning too.
I would add to Trini, that I think some of my partners beyond those already mentioned are uh, other corporate shared services. So in a big system like ours, we have an access center that really helps to schedule all of our patients. They're the one number you call, the people who pick it up and make sure you get scheduled with the right provider, the right visit. They're critical to our business. I think the other part that can't go unmentioned is our IT or ISD teams. Um, Everything we do is through our EHR. And so anybody who's touching Epic, our EHR, we have to really work closely with, because that's how we'll turn this into a workflow that benefits the provider and patient.
And in addition to those functions, I would say I most typically work closely with ambulatory operations to make sure that whatever our plans are actually feasible and implementable, and then to the extent possible, work with them to implement. And then on the flip side of that, work with our department chairs and their executive administrators to determine what are their growth goals and how can we help achieve them within our existing network.
Yeah, I
Wow.
mean,
Okay.
sorry, final comment. It's just build on, Matt, I think said it earlier, like what he was joking, why didn't I say bureaucracy? But when we do, we do a lot of large scale, I do a lot of large scale stuff in the system, and kind of what we always have in these meetings, like who are we missing? Because you probably need almost every shared service in the meeting, and right? And different specialties, because even I did one time a little project with spine, right? And this, what I didn't know, right? Spine, there's 4 different specialties that do spine work, right? And they almost all do the same thing. So imagine calling up for, I've got spine problems, who do you call, right? And so it's the same problem when you're trying to figure out how do we set that service up and how do you get the patient to the right place. And so you almost need to just start asking that question, who should be involved? And if it's not, probably like I said, your HR, your finance, your legal, right? And then other one that probably because I was associated with them and I'm on a current project, but our physician recruiting, right? So when you're looking at the future, like those are the people who know like what are, if you're trying to grow, you need to hire. And so, is it likely we can hire? How fast do you think you can hire? There's some specialties that take 2 years to find somebody, right? So is your plan even realistic, or do you have enough money set aside because that whatever specialty now wants another, whatever, 100,000, or they're only doing locum services? So something you just now think about regularly when you're going to the, growth programs, especially.
Terrific. The web of relationships sounds endless. So I'm sure, and that's something to bring up too, that collaboration, communication, so many of the soft skills, I'm sure, benefit you all on a daily basis so that you can do a better job, your unit can do a better job. So fantastic. So thank you for sharing those. I am going to read a couple of the questions in the chat. So we've got our AI question. So in the age of AI, how is the growing influence of artificial intelligence impacting healthcare providers and more broadly, the healthcare ecosystem as a whole? And how about large healthcare systems? And if y'all could just briefly, because I know this, you could go on forever about this, I'm sure.
I want to jump in. This is actually one place that's really exciting for us. We put in place a bridge, which is an AI scribe. And so think of it as when you go to have an appointment with your provider, they queue up their scribe and it starts to record. It puts all of that note into a format that they can submit for coding and billing. And what we have heard is that it has kept some providers from resigning or retiring. It allows others to be good providers and good mothers, fathers. So that's been like an easy win, I think, for us, but it's seeping into a lot of the other parts of our organization as well. And I think um, I'd love to hear Trini's thoughts on this because I know finance and administrative burden is are big opportunities.
Yeah, happy to go next. We've also implemented a bridge, so I was just going to comment and say it's been such a win with our clinicians. Have heard great feedback, and I think the other magical part of it is that patients, don't notice any change in their care other than having that same positive interaction with their provider. So I feel like for Duke Health, a bridge was one of our first foray into the AI space that really spread more broadly, but it has inspired a lot of experimentation in other areas. So we have had a lot of engagements, especially on the rev cycle team. There's a lot of administrative work there and things that are more manual than you'd like to think. So we've engaged with both our internal IT teams to develop certain tools that that have reduced the administrative burden and quickened our processes, as well as engage with vendors that have AI products that can help us with claims denial processes, that can help us respond to patient inquiries more quickly on our access team. And now we're starting to think through what are the ways we can use it for those back office functions too. Monthly reporting, our data analytics, how can we enhance those functions through the use of AI? I wouldn't say we're very far along in the journey. We're really still very much in the whiteboarding design thinking phase of it, but it's something that our executive leadership team is really supportive of and excited by, I think, like anyone in the healthcare space. So it's just an exciting time to be engaging in those conversations. I think it has huge potential, not only from a patient care delivery perspective, but really helping our teams rethink their work so that they have an opportunity to dedicate more brain power to solving more exciting, complex issues versus doing those manual, routine tasks.
I can go next and add two interesting tools that we have tried based on the AI. One is certainly the prior authorization, the utilization management team. They have to go through a lot of medical literature and they also have to go through the EMR content to decide that how do we substantiate that this person definitely needs a prior authorization. So that's where the AI tool has been really helpful in ensuring that the prior authorization requirements of the insurance is being met by the healthcare providers requesting for the authorization. So that's one. And second thing is where appointments, these appointments, the cancellation, we already have very scarcity of the healthcare resources in terms of the providers as well as in terms of the technicians infrastructure. So the appointment cancellation is just not good use of those resources. This is where, again, the AI is coming to our rescue, ensuring if there are last-minute cancellation with minimal human intervention, we can decide that how we can ensure that that slot is also filled. It also does a predictability analysis, meaning that if the patient is residing far away from the medical facility, there is a likelihood of cancellation. Or looking at the historical record of the patient, saying that this patient has not been meeting his appointments and doing a last minute cancellation. So all those analysis is also being done through AI and predicting that what are the chances of getting this appointment canceled, and then accordingly have a backfill there. So I would say to add on to the list which Matt and Trini have provided, there are few more examples that I can think of that we have been as process advisors. So sorry, I missed the introduction aspect, but I'm a process advisor working for a consulting healthcare company. So that's how these are the ways we are trying to help our provider clients as well as our insurance clients.
Perfect. Thank you so much.
Thank you.
All righty. So we've got a couple more questions. So I'm just going to move on because they're piling up, and that's great. So what do you see as the most important operational challenge facing large health systems right now? And why do so many organizations still struggle to fix it?
So who wants to go first on that one? Go, Greg.
Yeah, that's a loaded question. I mean, right? Like, who wants to, I would say it's in some ways the biggest challenge facing healthcare systems is the regulatory system, right? Like, that is what we all struggle with every day. And in fact, and it changes with administration, it changes by the month, it changes by the year, right? And so that's one side is the Medicare side. And then if they make changes, you got the payers making changes. So the commercial payers, that's what probably Matt deals with a lot. And they probably even make them every month. And then same thing is like once you figure out a way to bill for something, say I think Matt was talking about like the wellness visits. So maybe, they started wanting us to do more wellness visits. So we figured out maybe we were billing on a wellness visit and they realized, well, you're probably billing too many wellness visits. So let's change the rules on how you can do a claim against a wellness visit or something, right? So it's like a constant changing landscape, and each payer has their own rule set. So each insurance company and Medicare. And so, and when UNC we have lots of insurance. So I think, I can count, but it's, think of over 100. So when you have somebody at your front desk who's trying to make sure that they ask you when you're coming over which insurance, then knowing whether your insurance pays for that, that's like the biggest challenge of us. And so trying to create growth programs, trying to create care models that take care of the patients in the best way, but then make sure, as Trina said, like we still get paid, right? Like we do still need to pay our doctors and we do still need to keep the lights on. So someday we do need to still be able to get paid by somebody. So while our doctors are more than happy to give service as much as they can, we remind them like, how do we, what is that service we're giving? And so that's I think our biggest challenge. I would say at least what I face most of the time, right? Is how to figure out how to work through those regulatory challenges.
I can add on to that and maybe speak more from the operational perspective. I think access is a challenge at a lot of institutions, a lot of AMCs. I think in my role in strategic planning, I get to play a unique role where we work with ambulatory operations and we work with the recruitment entities, the medical group, department chairs, so on and so forth, to determine like how can we help fix this issue. Sorry, just getting a little feedback for a second there. How can we help fix this issue by understanding, based on all the available data sources that we have access to, how can we allocate our space and capital best and highest use in service of the patient who, we don't want them to be waiting for appointments. Of course, they don't want to be waiting for appointments either, but it's kind of like that give and take there. So yeah, to round out my answer here, access, I think in particular from the ops perspective.
Yeah, I think those are great answers, and that's what I would say as well. I'll say a newer challenge that we're facing as a health system, and I'm sure a lot of health systems are thinking about this, is cybersecurity. We're increasingly having to dedicate resources to thinking about that. I think if you've been paying attention to the Stryker Corporation and the cyber attacks recently, that's had a direct impact on our supply chain operations, IT operations. And we are in an environment now where there's just more exposure. So that's been a really big and growing area. As we're talking about AI and automation and all the exciting things that come with technology, there's kind of the flip side to that and having to think through how do we minimize our risks in that space as well.
I totally expected Trini to say payment because I was going to say it for time. But no, I would add misinformation, disinformation, because Measles vaccines. Never have we had to face quite a challenge like this, and convincing parents that this is the best treatment plan for your child and avoiding spreadable diseases like measles.
Thank you. Again, two grand challenges, but it sounds like you all are thinking about it and meeting them at the path. So thank you for that. The second part of the question, and this is from Venusia, it kind of leads into our next question. For us earlier in our careers who want to grow into health system leadership, what entry level roles actually set people up best for that path?
I can start on this one. So I'm a big advocate of the administrative fellowship route. I know for myself, coming from the policy and research space and then obtaining an MHA, I wasn't 100% clear on what direction to take afterwards, just knowing that I wanted to land in healthcare, but what were all the different opportunities underneath. And in a way, it buys you a little bit of that time to kind of figure out what are all these areas I could plug myself into. But it is also just a great experience to be a sponge, an opportunity to be a sponge and absorb as much as you can, and to be able to sit in with executive leaders and get that level of exposure you normally don't get so early in your career. Sort of how executives mentor and coach their teams, how they interact with each other, what are the things that keep them up at night. I think doing the administrative fellowship really puts you in the room to be able to observe those things that typically you might not get exposed to until later on in your career. So for me, it was a really eye-opening experience and gave me more insight into what I would pursue afterwards. So it's a pathway that I'm a huge advocate for those who are interested in a career in healthcare, but they're not exactly sure where they want to land yet.
And I'll second that, right? I think that's a great opportunity for folks who have no experience and just want to jump in the fellowship programs, right? So do look at it because you get a wide exposure to everything that your hospital does, and then they have opportunities then to move into almost any different area. Here at UNC, I know couple of the last two have gone into virtual care, and some have gone into some other different areas. They can go into operational positions after that. Um, I came into UNC Health from consulting, and then I went to strategic planning. And I'll be a little bit biased, but strategic planning gives you also same way like the fellowship. You get exposure to the whole system, right? And you have to learn how your system works. And so you can learn a lot of things through that process, right? And you get exposure to a lot of senior leaders. And so I think that for me, that was really neat and exciting. And, you can start off as an analyst or a consultant. So there's really entry level positions within systems for that kind of work. I think other places, right, especially maybe coming from the business world, rev cycle is an area, and then finance, I'll say, right, there's financial analysts, and they know how the whole system works and how things get operated. And so there's a really good insight into how, and quite honestly, as you go up, probably every system's a little different, but I learned, right, our finance and our CFO has a lot of say in what we end up doing at the end of the day, right? We look at him and say, can we fund this thing? And then we get a nod or not, and then we got to figure it out. So they have a lot of control and power in some ways good, but they have to learn how the system works.
I would just add my vote for strategic planning as well. Great way to get a lot of exposure to lots of different projects. One week I'm working on one project, and then 3 months later I'm working on something completely different. So drinking from the fire hose is really real there. The other functional area that I don't think I've heard mentioned is that I think has a similar benefit in that it's system-wide is transformation, but it's more like operational execution as well. So perhaps exploring entry-level roles in those areas, as a project manager or something like that, I think could be a really good path for an earlier career person to see the whole landscape and then maybe later on kind of pick where you want to focus if that's what you choose to do.
I was just going to echo that too, Micaela. I think for a lot of folks, project management, coaching, quality coaching, et cetera. Some of those don't require, say, a project management professional, or they will give you training on the job, Lean Six Sigma, et cetera. But like you get to see how workflows are made. And so um, that's a great way, I think, from the ground up. And it gives you opportunity to learn how to navigate interpersonal challenges with teams that you don't have direct responsibility for. Helps you set up for, I think, early management careers.
Perfect. Great advice. And I'm just popping in a few opportunities from UNC Health. Again, these might be closing soon, but at least this gives our undergrads or, students that want a little bit of experience. So just take a look at some of those. So there are all types of different pathways in, but again, too, I think all of the advice given to you by the panel, dig into that, especially if you're a student right now. So I am going to go ahead and ask another moderated question. What do you wish someone would have shared with you when you were a student or even just a young professional exploring career options?
I'll start because it kind of dovetails nicely from our last question here. I remember being in grad school and kind of like hearing about different like specific functional areas and thinking, okay, but what do you actually do? Like, what does your day look like? What tasks do you do? I'm a very pragmatic, practical person in case that hasn't come across yet. And it kind of seemed like everybody else kind of knew what those roles did. And I didn't necessarily feel the same way. Especially when you get to like, I mean, obviously I know the difference between marketing and strategy and finance, but when you get down to the details of, okay, but what does someone who works in capital budgets and finance do that's different than, provider budgets, and like, how do they work together and what does their day-to-day look like? So I think just like more insight as to kind of the roles available. And to do that, I would have more have more coffee chats for sure. Play the student card and reach out to people either through, contacts that the CBOH has or through your respective department wherever you are at UNC. Huge alumni network through UNC, or even just like honestly, even though it's a little cringy, but like cold outreaching on LinkedIn and just saying, hey, I'm a student, I'm really interested in learning more. Not only do you get to learn about a functional area that you probably don't have any idea about, but you make that connection for, maybe eventually they'll refer you in for a job or something like that. You never know where those connections might lead you.
I don't think they're cringy, but informational interviews are fantastic. And if you meet somebody, ask them if they can connect you with someone else that you think would be helpful based on your interest and their job. Um, Ask them if you can shadow. So most of us are willing to, so long as it's not proprietary or confidential. But I think those are all like really great opportunities to see the work and figure out if that's a direction you want to go.
Yeah. And I would just say, I mean, I think those are the right thing, right? Just be curious. Information interviews, that's what really helped me as I was transitioning out of the military, right? Like, trying to figure out like what I did versus and how that translates to what everybody does in the regular world was really tough. And so it was really good to just be able to connect with folks. And maybe I got to tell a lot of things. One thing that I'll tell you, I mean, this guy told me I was doing coming out of the military was just start connecting with everybody on LinkedIn. Like he was connecting with 30 people a day. And because I mean, like I was transitioning from a military and I didn't want to go into defense business. So I was trying to do something totally different, which is healthcare and energy. And so you really had to make connections and learn. And so you said like I mean, people are willing to connect with you. And so you had a goal, send out 30 LinkedIn a day. And even if half of those connect with you, you'll get some more and then just start connecting with them and learning more. And so that was really helpful for me.
And I'll just add, I wish I'd taken more advantage of the coursework that I had access to. there are times now where I'm like, man, I wish I'd taken that next level reimbursement class or that, next level accounting class. And at the end of the day, I think taking things outside of your comfort zone, those courses do help build that helpful foundation for the next phase. But I do echo what everyone says. I think the relationship building, networking, informational interviews, that really helps to inform too what the next pathway is. But you only get the one chance to be a student, so really take advantage of it.
I have to put a
Again,
plug in. Sorry,
okay.
just real quick, Suzanne. I put it in the chat, but I'm the past president of American College of Healthcare Executives, North Carolina chapter that we're in right now. And 54 counties, folks from Duke, UNC, Wake Med, ECU, Novant Health. This is a fantastic, inexpensive local way to network and meet people. So look up those websites, join those events. Many of them don't require that you be a member, inexpensive to attend. And so that's a great way to get to meet people in a more personable way than, attacking them with 30 LinkedIn messages. I'm just picking on you.
Absolutely. And again, professional organizations are always wonderful, and often they have discounts for students, if not free. Um, and so again, wonderful responses. I am going to put a plug in for our CBOH career networks. We actually have more contacts on there that all of the students can go ahead, search through. We have 7 verticals and those folks that you can reach out to that are ready to talk to you. All righty. And I have one last question because we've only got 3 minutes, but I think this is one of the most important ones. And what do you see as future trends or a future trend in your industry and or your organization?
But this one's for the strategist in the room, Micaela and Greg.
Well, we already talked about AI, so I won't dwell on that anymore. But definitely, right, continued shift from inpatient to outpatient, continued focus on value, right? Slowly shifting from fee for service to VBC, value-based care. And then I would say also continue focus on highly patient-centric care. I think as you're seeing like some of the primary care 2.0 organizations, One Medical, what have you, pop up that are kind of geared more and more towards the consumer. Health systems need to be careful about that we are also, meeting the consumer where they are.
Yeah, I mean, I'll second that, having done a lot of patient experience and just listening to the voice and what patients want is a big area I think that's going to start coming out more and more, especially with AI capabilities and patients becoming more informed and the cost of care keep going up. And so trying to figure out folks are going to probably take more ownership of their care, try to learn about how to manage those costs, right? And it's just downward pressures that are going to happen. I think that's some of it. I think along with that, like the new models of care, right? Like that's, I mean, whatever you want to call it, AI and other things, right? There's virtual. I've spent a lot of time doing that kind of work. That's really taking off. And so how much more can you do with virtual, right? There's Hims is out there making a lot of money in what their very niche area as well and hers. And so is that going to be a big area that's going to for the future?
Yeah, I think those are perfect answers. I would echo that. I think there will be continued pressure from a reimbursement and expense control standpoint. So, really good time for us to bring in more creative thinkers, problem solvers, and Tar Heels.
If you can keep up with it, our federal government is really coming up with a bunch of new models to test that are value care oriented. Not sure how many will stick, but part of it is testing it and seeing how it works. There are bundled payments around surgeries and joints, et cetera. And then there's how do we involve technology to help improve chronic care management? So there's a bunch of different models out there. We're only now getting into them, this year and the next few years. So keep your eyes peeled for that. The Center for Medicare Services has newsletters that you can subscribe to when those models come out, and they share some of the summaries of it. That can be a helpful and interesting thing. See where those organizations are that are signing up for that and learn from them.
Terrific. And you all are spot on. We are only a minute over, but I cannot thank you enough. This has been a truly wonderful conversation, very informative. I want to thank you all for taking the time tonight. And I also want to thank our audience for coming and for people being interested and wanting to learn a little bit more. So again, thank you so much. We enjoy seeing y'all, but we'll see you next time. So everybody have a great evening.
Thank you so much. Have a good evening.
Thanks all.
Thank you.
See y'all.